Well, today we received the designation from the World Health Organization as a healthy city, which is something we're very proud of, and we've been working very closely with many of the other service providers in Cork City to try and achieve. We've been working very closely with the UCC, with the HSE, with Niche and many other service providers in a collaboration to make Cork a better place for people to live and to visit. And what we're trying to do in Cork City Council is to ensure that all the policies that we decide to carry out on behalf of the public impact in a very positive way. So in terms of our recreation and amenity, we want to ensure that we have enough parks and trees and recreation facilities, not alone for our young people who can play sport in the city, but also for our elderly people who may wish to walk. And so in terms of cycleways and walkways, that'll be something that we'll be rolling out over the next number of years on top of what we have already. Clearly, in terms of our housing and our planning, we want to ensure that the type of houses that we build and the housing estates are such that they're not huge big estates far away from the centre, so that people will be able to walk to shops and to churches. And also to ensure that our city is an area where people can walk or those with disabilities can get about easily. So it's a holistic approach, because health isn't just about going to your doctor or prescribing medication. It's about how you live on a daily basis. It's about your quality of life. And Cork City Council's policy is to ensure that the quality of life of our citizens is the best in the world. We're very proud of the UCC as a very important partner to us, not alone in this instance but in many other instances. But in terms of the city designation, the health designation for Cork City, UCC have worked very closely with us in that respect.
Well, as the Lord Mayor said, there are many different benefits. The first really relates to the bringing together of information from all sorts of different sources, capitalising on the information that the city acquires about itself, the information gathered by the voluntary sector on their own activities and their own outcomes, and then putting that in together with public health information and information which is gathered by academics to get an overall view of the health of the city. And that's a sort of starting point, gives us a baseline from which to work, and then from that it stimulates us to try and improve matters. We've identified significant challenges that face the population of Cork in regards to their health, and we now can move forward to try and address those in a more coordinated and comprehensive fashion. We know that, first of all, like many large urban centres, we have significant problems to do with urban deprivation, which in turn impacts negatively on people's health. So people have a relatively poor health experience, cardiovascular disease, cancer and so on. These are the major killers in all developed societies, but there's also very great disparities across even quite a small city like Cork by global standards in terms of the experience of these problems from different parts of the population. And this again allows us to focus on that and see how we can address that to reduce the health inequalities and get more equal health experience, but also overall better health experience for the whole population of Cork. It gives cities a more realistic view of their own health and the health challenges faced by their citizens, and it also then stimulates actors, various stakeholders as I might call them in the different cities, to work together more closely, to work in a more coordinated fashion and to address the health through more coordinated activity. And it also stimulates people to introduce new activity with a focus on health. It's gratifying to have our endeavours recognised. We've been working away at this for some years now, working together in a very fruitful way with partners and colleagues from all different sections in Cork society, but it's nice to have that recognised, and it's also then an impetus to us to go forward and try and improve matters further.